Welcome back. Dr Pankania, throughout the crisis, has provided an informed critique of the policy measures which have thus far failed to control the virus across the UK. He speaks now to Alex.
Dr Pankania, we're now 18 months or more into the coronavirus, the COVID infection, but still a huge number of cases in the United Kingdom every day. I mean, 30,000 new infections regularly. Are you surprised by the apparent inability of the vaccination programme to get to grips with these sort of numbers of infections?
I'm not surprised, I'm disappointed. And my disappointment is that we have mismanaged it in the United Kingdom. Without a doubt, if we look at comparable countries in our neighboring Europe, Germany, France, Spain, Italy, their case numbers, their deaths, their management is better. And the reason we need to learn from them is simple precautions, simple, easy measures actually help, and they help suppress case numbers.
Can you put your finger on where these weaknesses stand? I mean, what it is about the management across the 4 countries of the United Kingdom, which has seen the infections still spreading at such a high rate? So the premise that we have to always remember is this is a person-to-person spread of infection. We try to find all sorts of complicated ruses to keep the case numbers down. The key point is this is person-to-person spread. That means wearing masks in public places where there are other human beings in close proximity. Where would that be? Buses, trains, tubes, crowded shopping centres, etc. Second point is that whilst our immunization program has been good, unfortunately, some of that immunity is now starting to drop off. But that's not the bigger concern. The bigger concern is we have not fully immunized the younger age groups, and we have failed to grasp it and address it and accept that children do get infected, children do infect others, and children are sources of propagating infections into older age groups. So when we last spoke in this show, Dr Pankania, you warned that the dangers of taking children back to school before a vaccination programme for teenagers. Have these warnings come to pass?
Unfortunately so, and it is extremely disappointing because at that point I was saying the United States, Canada, Israel, European Union, all very good countries with very good scientists with whom we often work together. And for the United Kingdom to be a standalone from all the other scientists in all these countries where they have really good scientists made me wonder. Furthermore, it was even more disappointing, really hurtful, that we finally saw the Joint Committee for Vaccines and Immunization minutes 5 months later. 5 months later. It is extremely painful to see that. And the reasons given for making the decision not to immunize the teenagers in those minutes was extremely disappointing. It was based on very flimsy premises that it was marginally beneficial and therefore we're not going to go down this route. They got it wrong. Not only did they get it wrong, they published their minutes 5 months later.
Well, I can say as a decision taker in previous examples of threatening viruses, not as serious as COVID, but the swine flu, that what you wanted, what you needed as a decision taker was clear, but above all, timely advice from your experts, so that if you made a decision, that it would have an effect. Are you saying that both in terms of the SAGE committee, with its lack of expertise and people who'd be on the ground infectious disease control, and now in the vaccination committee with the endless delay before they make decisions, that these key institutions have proved not fit for purpose in this most severe of all pandemics?
Yes, and it is very disappointing because, Alex, infectious disease management is not super rocket science. It is pretty straightforward if only we would do the basics, the fundamentals. And the fundamentals are we need to suppress infections universally from all age groups. And if you suppress those infections, you create fewer cases. It's as straightforward as that. Furthermore, another example, finally, a year later, today, I hear the UK government is finally addressing the issues of ventilation. People like myself, and I am a lightweight, have been talking about ventilation for at least a year. And it's finally today being addressed that ventilation is a big issue and we've got to do something about it.
The case numbers in Scotland, not as serious as the case numbers in England in the last month, but nonetheless, still the infection raging at a very high level. And we've had this enormous international vital conference, the COP26 in Glasgow. Does it make you a bit uneasy having 30,000 delegates and their entourages with maybe 100,000 demonstrators into a country of Scotland and a city where infections are running at a high level? How uneasy does that make you as a public health expert?
Yes, and whilst I'm 101%, if there is such a thing, subscribe to global warming and sustainability as an imminent danger, the idea in the middle of a pandemic into a small country of having, as you say, 100,000 plus delegates, of course there is an introduction of risk. Of course there is. And it will be interesting to watch the case numbers in Scotland further to COP26 taking place. Of course, it is a risk, and we know the science, and it's only a matter of time when we see case numbers rising. The good thing is, not to cast dark shadows on this event, which is very important, is at least most people are immunized with 2 vaccines, and therefore, even if they were to get infected, hopefully most of them will not be seriously ill, and very few will end up being admitted to hospital and being put on a ventilator, etc. So the pluses are that, of course, case numbers will go up, but I hope that there is a disconnect between case numbers and being admitted to hospital due to them being fully immunized.
Now, we're still in a situation where some hundreds of people are dying every week in the United Kingdom across the 4 administrations. But the amount of publicity about that seems very low. I mean, have we become not immune to the virus, but almost immune to the impact of hundreds of people dying every week? I mean, what is it that gets people inured to a dangerous virus circulating at such a level and killing so many people?
Yes, so there is that clear fatigue, and people just say, 40 people died today, and it's almost water over a duck's back. It is unacceptable. What we need is a comparison, because people have become fatigued, but we need a comparison, a clear indicator. In Germany, in France, in Spain, the daily deaths is X. In the United Kingdom, the daily death numbers are X++. And we need to constantly feed this back to the public that the UK is not doing as well as the European Union. Why? And what can we do about it to become as good as we can? Because we are not as good as we can be.
Now, Dr. Pankania, if you had the ear of government, which many of us wish that you had, what would be the one measure you would say to the leaders across Scotland, Wales, Northern Ireland and England? What would be one measure you'd say, for goodness sake, do that now, at this stage in this pandemic?
You always have to act early. Early reactions, early control measures result in better control, more succinct control, more in charge of the outbreak. So early extensive actions is the best course of action. Delayed actions, delayed minimal interventions equals you never get into control with the outbreak. And in the UK, unfortunately, we have been delayed, limited actions, and as a result, we've never caught up. If we had early, extensive interventions, we would be in a better place today.
So, Dr. McCanny, how confident can we be that if you're lucky enough to have had the booster vaccination, that you're not 100% protected, but you're not far off it? How confident can we be that once you get the booster, you're safe from this virus?
No, we cannot say that, and we mustn't say that. And for Secretary of State for Health and Social Care, Sajid Javid, to lay a lot of singular emphasis on boosters is a smokescreen. The important way of managing case numbers will be as follows. It is multi-layered. It has to be multi-layered. So you have to immunize people who have not yet been immunized. You have to give the boosters to the vulnerable people. And furthermore, you have to also address other issues. The other issues are equally important. The other issues being wear your mask, wear it properly, wear it in crowded places, wear it on buses, tubes, trains, and crowded supermarkets. Furthermore, the big elephant in the room that we are not addressing, and this is extremely serious, is the seasonal influenza vaccines, because it is already circulating in Europe, and we need the schools' seasonal influenza program to gather pace and momentum, because they will infect other age groups. And we know that the strain that is in circulation makes poor immunity amongst elder people. So we need to suppress influenza very much so this year. So it's a multi-pronged approach, multiple layers, as well as please attend to seasonal influenza immunization urgently.
Sound advice, Dr. Pankania. Let's hope it's implemented. And thank you so much for joining me once again on the Alex Salmond Show.
Thank you.